Good afternoon to everyone present here with us today. This is Shriyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome our very renowned doctor, Dr. C.H. Asrani. Sir is MBBS DNB Family Medicine, founder chairman of Inches Group. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is emerging viral infection, preparing the practitioners for future challenges. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, sir.
Thank you, Sriyan. Hello, friends. We have seen that newer and newer viral infections or newer forms of old viruses are cropping up, leading to great confusion, both among the population as well as among doctors. So, today's talk, I'm trying to convey a way that a good practitioner should think and prepare himself to manage a new viral infection that hits us and our patients. What's a virus? We all know virus is a very tiny infectious agent that replicates only inside a living cells. A virus needs a live host. Once the person is dead, the virus cannot multiply anymore. They infect all kinds of life forms, animals, plants to microorganisms. They even infect bacteria. And the viruses that infect bacteria are known as phages or bacteriophages. They are found in almost every ecosystem on Earth and the most common type of biological entity, and they mutate, they keep changing their shape. Emerging viral disease is a term used to describe appearance of a previously unrecognized infection in a particular host species. Since we are concerned with humans, a veterinarian may be concerned with infecting the certain amount of birds or cattle. So this is an unrecognized infection we are talking of. The virus may be known, but the infection is new. Previously known infection either in animals or birds that now has expanded to affect the humans. And then when they do that, the pathogenicity changes. It may be quiet in birds and animals, but it may become very virulent in humans. Example is emergence of SARS in 2003, severe acute respiratory syndrome. It was a coronavirus. So coronavirus was known even in 2003, but our COVID pandemic was the same virus with a different pathogenicity. This outbreak began in Foshan, China in November 2002 and lasted until May 2004. This is the history of some of the epidemics and pandemics of viruses from 57 till 2019, and what is next we cannot predict, but we have to be ready. And you all will agree with me that in the previous pandemic of COVID, social media played a spoil sport. It was more harmful than useful. Why does new viral infection occur? The factors that make new viral infections possible and make their spread possible are ecological, relationship between living organisms and our environment, environmental, natural world of land, sea, air, plants, and animals. And environmental, we all agree that the world has become a global village. The kind of transport, air transport, the kind of people moving, it won't take time from one infection to reach from one place at least 10,000 kilometers away. And lastly, demographic, the social characteristic of a population, race, age, gender, etc. These are the factors that place people at increased contact with a previously unfamiliar microbe or virus or bacteria and natural host, that is us, and promote dissemination, how it spreads. We will discuss this topic among these headings: identity of the virus, portal of entry of the virus, factors affecting viral entry, pathogenesis, incubation period and multiplication, shedding of virus, virus and host interaction, clinical features, investigation, management. Whenever a new infection comes up for which nothing is known, even WHO is silent, CDC is silent, we have to start thinking on based on certain reports that we get. Portal of entry. A portal of entry is the way a virus enters a person's body or a human being. They can enter the body through skin, more likely if there is an abrasion or a cut, respiratory tract, GI tract, or other routes, including fomites. Fomites are surfaces or inanimate objects which can harbor viruses for some time before people pick it up. Respiratory tract, they enter through nose or mouth, and which is the commonest for people to get a viral infection. More so in our country where we have a huge population. So that, in other countries where social distancing is natural, for us, we have to think and practice it. GI tract, certain viruses, enteroviruses enter through mouth or anus, fecal-oral route. The stomach and duodenum protect the body from many viruses because they get killed in the acidic fluid. Genital tract, viruses can enter through vagina or penis. HIV, hepatitis B are the commonest. Conjunctiva, the viruses can enter through eye. Viral conjunctivitis is commonly known. Vertical transmission. Transmission from mother to child, either through placenta when the child is in womb, during birth, the delivery passage, or through the breast milk. Skin. Viruses can enter through wounds or abrasions. What factors make the viral entry possible? Our defense mechanism. How much is our immunity? Am I a healthy immune person or am I an immunocompromised person? Any disruption to our body's normal defense mechanism will allow viruses to come in and multiply. The viruses will also enter an immune person, but the viruses will be destroyed before they affect the body. That is why immunocompromised patients are a challenge for every infection. Environmental factors, the temperature around, people staying in crowded environment, what kind of lifestyle they have, that can impact how long a virus can survive on a surface. In the body, they will multiply. So like HIV cannot survive outside human body even for few minutes. Sunlight will destroy it. Hepatitis B is a hardy virus. It can survive outside our body for years together. Our body receptors specific viral ligands, where it is RNA virus or a DNA virus, and our cell receptors, they combine, and that determines how a virus enters the cell. The final outcome of infection is determined by the dose of virus inhaled or entering the body and the location of the virus. So, coronavirus COVID entered through the nose and affected the nose and throat and respiratory tract, subsequently going into lower respiratory tract causing pneumonias. Pathogenesis. What pathological changes happen in our body due to the virus that causes the infection? Local replication and local spread. Most viruses spread among cells extracellularly, but some may also spread intracellularly, like herpes simplex virus. Establishment of a local infection by the new virus entering will lead to a localized disease and localized shedding of the virus. Virus shedding is important for or responsible for transmission of infection from one infected person to another uninfected person. Dissemination from portal of entry, it has entered through my nose because somebody sneezed in front of me. Now it has two ways of spreading. One is viremic through the blood, systemic circulation, where the virus reaches via lymphatics. And second is they may enter the target organ. Now every virus will have a target organ determined which it will reach. Hepatitis B, target organ is the liver. Hepatitis C, target organ is the liver. So either they multiply in endothelial cells or fixed macrophages. They diffuse through gap between cells because they're still extracellular, or they're carried in a migrating leukocyte. They stick to the surface of the cells. Neural, sometime dissemination occurs through nerves, which is common in herpes virus and poliovirus, and also rabies. So if I know the incubation period, I can tell my patient how long they should isolate themselves, even from the family members, or when they can go back to work if they're clinically better, and how does the virus multiply. The incubation period is the time between exposure to me and the onset of disease. During incubation period, which is usually asymptomatic, viral implantation, viral gets implanted, it gets multiplied and spread. In cases where the spread is all through the body, not in one organ. Depending on the balance between the virus, how virulent the virus is, and the host immunity. If the balance is proper, the person will not get a disease. If the immunity is low, the balance is in favor of the virus, the person will get a disease and may even get death. Shedding of virus. The dissemination of the virus or a vector through secretions or excreta of the patient. Now in COVID, we knew that the virus goes through nasal and oral secretions. HIV, we know, can pass even through the stools or through the urine or through the vomitus. During influenza infection, virus is shed in nasal and oropharyngeal secretions and disperse through sneezing bouts. In healthy adults, virus shedding peaks during first 24 to 72 hours of symptomatic illness and usually last up to 5 days. So if I have a patient who's diagnosed of a condition today, symptomatic, I know that at least 5-6 days he will pass on to others. That is why the last rest period or isolation phase of COVID was 5 days and not 15 days. It's important to know how long a patient is infective. Virus affecting host. How will the virus affect the host? Since they are unable to reproduce by themselves, they barely qualify as living things. Although we say the virus is a living thing, but it cannot reproduce by themselves, it requires a living host, as I have said in the beginning. They are well designed to infiltrate host cells and replicate copiously. Those of you who have learned HIV in detail know that an HIV virus can produce billion copies of itself within 24-hour period. Once a virus gets into a host's body, it travels along the surfaces of cells until the viral proteins begin to bind with the receptors on the cell. It depends on which receptors, whether the protein is DNA or RNA. They enter typically in the respiratory tract, mouth and nose, because this is the commonest route of viruses going in, particularly for pathogens such as rhinovirus, coronavirus, and influenza virus. Enteroviruses enter through GI tract, HIV, hepatitis B, and herpes through genital tract, but herpes also the herpes genitalia virus, not the skin virus. Some enteroviruses are responsible for 80% of meningitis cases in children. So enteroviruses may enter orally, but they can travel to the brain and cause meningitis. Then, since the viruses are on the surface of the cell, till they fuse with the receptor, allowing the DNA or RNA in the virus to enter the cell, and which is where it begins to reproduce. If a viral is virulent, it takes over the DNA of the cell and starts reproducing. So we have to understand how it is affecting. If enough viral matter is able to penetrate host cell without being deactivated by my immunity or other antiviral mechanism, like if a person is already on some medicine, the infection begins, the clinical phase begins. The replicating virus may stay at the entry site, or it may spread to other cells and tissues via the bloodstream, totally depending on how virulent the virus is and how good or bad the immunity of the host is. This bloodstream enabled spread. Most viruses will spread through bloodstream, very few through nerves. Will allow the virus to have a far-reaching effect inside the body. They can travel to multiple organs. Then they may spread via nerve endings to attack the nervous system if the virus has affinity to nerves and causes problems. Our immune system. So it is always better whether there is a new viral infection on or not. It is always better to keep our patients in a good immune status. The immune system reacts to injury of these cells, the cells which have been destroyed by the virus, causing symptoms like fever and chills. We all know fever is a protective mechanism, but today's social media, parents are giving paracetamol 650 even to 9-year and 10-year-old children. We have to convey to our patients that an elevated temperature generally is considered a protective response to destroy the virus or the offending organism. Avoid treating fever of 99.5, which may actually be beneficial to us, and please avoid treating a feverish feeling. Never to administer paracetamol without having checked the fever, because that reading is going to help you treat the patient. Chills. There is general perception that fever with chills is a very serious condition. So they will repeat paracetamol within 2 hours. They have to be told that chills happen because our defense mechanism raises our core temperature to fight the infection, and then we suppress the chill by giving paracetamol. Clinical features totally depend on which organ the virus is going to affect. Symptom and signs depend on system affected. Commonest are, we know, upper and lower respiratory tract. Examine the affected organs. Based on the organ that are affected, always watch vitals, oxygen saturation, because most common problem is respiratory tract, heart rate and BP, that tells you the general condition of the patient, and temperature. Always give a chart to the patient to monitor temperature. It's irritating when people keep sending you images of the thermometer. Tell them, please write down on a piece of paper. Look for affected organ decompensation. For us, when we are treating an unknown infection, it is very important to understand the concept of decompensation. I will explain taking the example of heart. A person with normal left ventricular ejection fraction, which is 60 or 65, a person has an ejection fraction of 40. The heart is not functioning too well, but this dysfunction is compensated. The person is asymptomatic. And when there is an insult to the body, when this decompensation occurs, the person may go into heart failure. Similarly, if my lungs are tolerating the virus onslaught, and they may be damaged, but that damage is compensating. I'm able to manage saturation above 94. My heart rate is 18. My pulse rate is 90. My BP is normal. I may be symptomatic, fever of 104, complaining of breathless, but I'm compensated. The minute I require oxygen, that becomes decompensation. So, friends, the most important part of handling a new virus is to identify which organ is getting affected and look for the decompensation of that organ. And although sepsis is caused by bacteria, but in viral infections, you get sepsis because if the immunity goes down due to the viral infection, any innocuous bacteria may cause sepsis. So look for the signs of sepsis also. So clinical features, we have to understand what the virus is affecting and how critical is my patient. Investigations, basic only, CBC, CRP to understand the inflammation. Specific tests to identify virus are not always required. Like we all keep treating influenza, but we never check for swab in every case. Test for comorbidity, making the patient a high risk patient. My patient is a diabetic. I have to check when he gets a viral infection. I have to check his diabetic status. If he's uncontrolled, he's immunocompromised, he's more at a risk of complications. Test for complications, like in COVID, we saw D dimer, you do chest x ray, you do HRCT based on the symptom. I'm talking now only viruses because a large percentage will affect only the chest or respiratory tract. Management, assurance, and counseling. Today, for us, treating a patient has two prongs of attack. One is treat the disease, second, treat the family and the social circle. Reassure them, avoid panic driven antibiotics. Doctor, please give antibiotic. He is very much suffering. No, I will not give unless I have an evidence. Antiviral, if proven effective, if there is a report somewhere that this antiviral medicine works for this virus, then only you give, because antivirals also have a lot of side effects or indicated by authorities, ICMR, WHO, and the best place to research is Center of Disease Control US, cdc.gov. Herpes, the commonest antivirals are acyclovir or famciclovir or valacyclovir. Influenza A and B, we all have seen oseltamivir works very well, which is available under brand name of Tamiflu, and zanamivir, which is a spray. Supportive treatment, every fever has to be ensured that patient is hydrated, 2 to 2.5 liters of fluid in a day, good nutrition, fruits, salads, rest, and monitoring vital parameters periodically. I have a habit which I do generally. Most of us have a Gmail ID. If you hear of a new infection come up, you go to your Gmail ID, go to your system setting, and set up an alert. Every day, a mail will come to you from Google telling you what new news has come pertaining to that particular disease over the internet in last 24 hours. So always keep yourself aware of what is going around, especially in a new infection which we have not learnt in textbook, which we have not learned till now in our practice. I'm open for questions.
Thank you so much, sir, for this wonderful presentation. We do have some question if you'd like to take that up.
Yeah.
So, sir, the first question is, what are the current limitations in laboratory diagnosis for emerging viral infection and how can they be addressed?
See, current limitations are, unless we know which virus is affecting us, then you can only do general tests to see the pathogenicity. Like now, for influenza viruses, there is a test called BioFire, which detects 5 viruses, including COVID virus, that costs in Bombay at least 16,000 rupees. And half the time, it picks up rhinovirus, which has no specific treatment. So that is why I said that identifying the virus is not always necessary unless the patient is in a bad shape. Then, if a new virus comes in, the National Institute of Virology in Pune will tell you which test is to be done. And then, if you keep your eyes and ears open, you will know which is the right test to be done. Next, please.
Next question is, sir, how can clinician effectively manage cases with limited evidence or treatment guiding or for newly emerging viruses?
Very good question. Number one is do not get carried away from what people are talking. Always restrict your search to certain credible sites like cdc.gov, I told you, WHO, our ICMR. Keep looking. MSD manual, professional version. These are the sites which will give you most updated information and you follow them.
There's
We
one last question.
normally, no, sorry, I'll just one more line. In
Sure, sure.
India, we don't get very advanced information. That's why I'm mentioning overseas sites. Yeah, next question.
Yes, sir. There's a last question. What legal framework governs the reporting and management of emerging viral diseases?
Well, I myself hold a diploma in medico legal system, but I personally feel there is no legal framework. It is only when the authority, like here we have ICMR, that announces that okay, there is an epidemic, there is a pandemic, there is an endemic, then only, but we have to keep treating each patient and make sure that we are not harming anyone if we are not helping anyone. Now, I do not know from where is the audience, but you must have read today, or rather in last 2 days, 67 cases of Guillain-Barré syndrome reported in Pune, which is like a rarity. But since Guillain-Barré is an autoimmune response of another infection, they've identified Campylobacter. So in India, legal framework for healthcare doesn't exist. That is why there is so much of abuse or misinterpretation of data. And that is why I said twice in this talk, let's not get carried away by what social media reports or what people come and force us to do.
Thank you so much, sir. That's all from our audience. Thank you for answering
Thank
all
you.
our questions. So, before concluding, any take home message from your end?
I will just say that keep your eyes and ears open about the news coming in from credible sources. Always look for vital parameters that will tell you whether your patient is going down. Just in newer infections, when there is an epidemic or endemic or pandemic on, stop treating on telephone. You have to see the patient and always keep the pre-existing diseases controlled. That is my message.
Thank you so much, sir, for joining us today. With your permission, I would like to conclude today's session. Thank you.
Thank you very much. Thank you.